Well, services have been disrupted at several government facilities around the country. This as trade union NEHAWU is continuing with its demonstrations. Workers, to remind you, demanding a 10% salary increase, but the Department of Public Service and Administration only offering 4.7%. NEHAWU has vowed to intensify its strike until its demands are met. So what is happening on the ground? Let's head over to eNCA's Nqobile Madlala, taking a look at the situation, joining us now down in Durban as well, and give us a sense then of just how disruptive the strike action has been in Nqobile.
Well, it's been very difficult for many communities that have been trying to get assistance in some of these public areas. I do know that some of these hospitals that we have gone to, especially Northdale and areas like Gray's Hospital, has been very difficult for any people to get assistance. We spoke to some of the people that came out and said they couldn't even get treatment in the area. So it's been very, very difficult for many people that needs health assistance. But I'm going to get the MEC to speak to us about those issues. MEC, we heard the CEO yesterday basically begging the workers to just give him a skeleton crew and nothing was going to happen. Have you spoken to NEHAWU? Is there any solution to this?
Which CEO?
CEO from the Gray's Hospital.
Oh, okay. No, thank you very much, and thank you for having us. It really has been a very difficult situation that we are faced with. I don't think in this dispensation, or in this term at least, we have had this kind of industrial action as the public sector. So, you know, it really is quite draining. Over the weekend, the DPSA, because as you know, this is a national strike, DPSA on behalf of government went to court, and there's been back and forth between government and the unions in court. And our understanding is that the strike as it is illegal, and we have actually been given a letter that comes from the minister indicating as such, both to us as political leadership and to the HODs as administrative leadership. We are hoping that there will be discussions with the unions, because it also becomes very difficult to negotiate in our different corners on matters that are at a national level and at a bargaining level element as well. So we expected that leadership of the unions would understand that health workers, or majority of health workers, in fact, are essential services. Therefore, they cannot not be at work. But it becomes even worse when you have health workers who are stopping patients from accessing services in our hospitals and in our clinics. And we have then had to ourselves resort to a legal framework, particularly where we had to go to court ourselves and get our own interdict in relation to what was happening in eThekwini. The situation in eThekwini has come down a little bit, and I think it helped that we had to meet with the SAPS. We also had to meet with eThekwini Metro, and together with our own security people, we were then able to manage the different facilities in eThekwini, although the situation is not totally controlled, but it at least has been managed. I know today that in Prince Mshiyeni Hospital, we were able to stop people from coming in until some people went in and pretended to be patients, and only when they got inside, they started trying to intimidate our workers, and we had to intervene very firmly and move them out. So the biggest problem that we have had today is indeed in Gray's Hospital, but it's not the only hospital. We've had a problem in Herigwala where people couldn't come in. We've had a problem in Northdale Hospital where people couldn't come in. So we are really finding this situation to be very, very difficult, and we are calling on our health workers to remember that they actually took an oath. They took an oath to save lives. They took an oath not to defend or not to stand in their life, or not, you know, to tamper in any way with a human right. And access to health is a human right.
And I mean, talking about that human right, we have seen a lot of these areas being any officials going to the ground to maybe have any conversations? Because, I mean, they've been talking, if we speak to the unions, they've been speaking about the fact that there's a breakdown of communication between you as the officials and the unions at this point.
Well, the unions know that their negotiations are not at our level. Negotiations are at a bargaining chamber level, and that is where negotiations should be. It would be very improper for us to have, we're not a federal country. We are not, we can't have federal discussions. When we have negotiations and discussions, they're negotiations that actually covers everyone. Now, where we have problems that are facing the Department of Health in KwaZulu-Natal, we are then able to go directly to the provincial leadership and speak with them and deal with the issues. And we often do, I must say. We have very good relations with the union in KwaZulu-Natal because we are able to deal with the different issues. However, this matter is a national matter, and we want to defer to those who should be able to negotiate and discuss at our level. If we are going to be discussing and negotiating at a level of the province, that then becomes an issue nationally because it will not be in line with the discussions that are there. But again, we are making a call to the leaders of the unions to say, allow health workers to get into our facilities so that they are able to save lives. But most importantly, do not stop patients from coming to our facilities, because if you continue, or if they continue to do so as unions, they will have blood on their hands.
And I mean, tomorrow is going to be another day, and if we see more unions going to the streets, what's going to happen to those people that are needing these essential services?
We have started, as of yesterday, as the Department of Health, to have frequent meetings. We meet in the morning and in the evening every day from yesterday. We had our morning session today as well, and we'll have another one later in the evening. The intention of these two meetings is to look at where the challenges are and what kind of assistance needs to be implemented. Yesterday, the biggest challenge that we had was the security cluster that was not assisting us as such. Hence, in the evening, we had to meet with the police, the SAPS, and together with the Metro. And today, we found that in most areas, of course, Grace being a bit of an exception, we found that in most areas the SAPS were able to come in and assist, and therefore today we were then able to focus on ensuring that we have the human resource or the required human resource within our facilities. So we have been able to come up with a human resource plan that says, how do you ensure that the service continues to be provided in the different hospitals? I'll give you an example. There is one hospital where you only have two cooks in the kitchen, and there's a nearby hospital. Well, by nearby I mean maybe about 50 kilometers away from each other. We then had to find a way of rationing. How do we get meals from the other hospital to go to the hospital where there are only two people who are cooking, so that we are able to share resources? There are other facilities where you find that a facility, for instance, Queen Nandi Hospital is a children's hospital. And by it being a children's hospital, they have regulations on the nature of patients that they take in and so forth. But under these circumstances, we've had to take a decision that any child that needs assistance, it must be able to go to that hospital. So our planning is in relation to the health services that we are now providing, to say, if we need human resources, where do we get it? What kind of human resources are we talking about? We are right now talking to all the managers at head office to say, where there are issues that we need human resource in terms of administration, get the managers to go and assist in those facilities, so that people, or our people, when they need assistance, they don't have to wait for too long.
Thank you very much for speaking to us, MEC. Well, I think, Gareth, it's very clear. All hands are on deck, and we will find out tomorrow what happens.
Yeah, absolutely. So that's the situation down in Durban, down in KZN, with Nqobile Madlala and the authorities down there. A little bit later this afternoon, just after 4:10, by the way, I'm going to be hearing from the Eastern Cape Department of Health. They've also noted these acts of violence and intimidation at their healthcare facilities as a result of the NEHAWU strike. So we'll be hearing from the Eastern Cape Department of Health on the same issue a little bit later here on the show.